because of how COVID works, because it is what we call a virus, it doesn't we cannot treat it with antibiotics. And I know that we use antibiotics for a lot of things when we're feeling sick, but COVID is because it's a virus that antibiotics do not work. So we rely more on your body's own immune system and its defenses, and we try to help support that with different things. And so, for example, when you get sick with COVID, you can have a fever. So using Tylenol or ibuprofen can be helpful to make you feel better, to bring that fever down, and to help relieve the discomfort you have with COVID. Many people will feel congested, and they cough and they have all this stuff coming out of their nose, all this gunk. There are things like nasal saline sprays, which you can use, and it's basically salt water. And salt water is great for getting congestion out. So it can really make you feel better when you have all of that stuffiness. Stuffiness can cause you to have headaches. It can make you feel really tired. It just makes you feel crummy and uncomfortable. When you're having cough, there are medicines like Robitussin, which you can take to help relieve that cough. So a lot of what we're using are things that you can buy in the stores to help make you feel better while your body does the big lifting of fighting off the COVID infection with its immune system. There are people who do have trouble breathing sometimes. So we have people who feel like their chest is tight and they feel like they have a hard time taking a deep breath in. You may have heard of things like inhalers. So they have inhalers or sprays that can help open up the airways over the counter. But for many of the inhalers that really help with breathing, you have to get it as a prescription from your doctor. And that's where it gets a bit tricky outside of just using the at-home remedies to help make you feel better. So if you do have a doctor, it's great to call them and say, "Hey, this is how I'm feeling. My breathing is harder to take deep breaths in. I'm feeling more uncomfortable and sick. What can I do?" Many doctors will say, "Hey, come in. Let's take a listen to your lungs and just make sure that your lungs are okay when you breathe." And if they do find that you can get more benefit from a medicine, they can give you an inhaler, which helps open up your lungs. And your lungs, you can think of as like a big tree with a lot of branches, and those branches hold oxygen at the ends of the tree. So albuterol basically opens up the branches and makes the branches wider. That way you get more oxygen in every time you breathe. So that can be really helpful when you feel like you're struggling, you feel like you're tight. The inhaler will open up that space and you just feel more comfortable. So that's an example. Um, as far as additional medications go, there are a couple on the market right now, and you may have heard about some of these medicines. Remdesivir has been something that's been thrown around in the recent past. That's used for people in the hospital who are very sick from COVID, and it's used to help prevent them from getting sicker. Right now, we have a medicine. It's a pill, and the pill is called Paxlovid. And I don't know why they came up with these names. They're very unusual, but basically, it's a pill that you take for 5 days, or excuse me, 3 pills that you take for 5 days. And it's for anybody who is 12 years old and above who is at risk for very dangerous complications from COVID. So it's used to make you feel better if you have really mild or sort of moderate symptoms, as we like to call them. So those would be things like having a cough, runny nose, fevers, just feeling tired, like those kind of things. If you are having trouble breathing, or if you can't take a deep breath in, that's an emergency, and you should be seen by your doctor, or go to the emergency room for more quicker care. But if you have those other things like colds, like runny nose and fevers, Paxlovid can be helpful because it will keep COVID from getting worse and more dangerous, but it can also make you feel better a little faster as well too. Very tricky. So there are a couple of ways that you can try to navigate that. The internet is a powerful thing, and if you do have a computer, it can be helpful, or it can be useful if you go on Google, and then you can look at Google a medical facility or hospital. So for example, if I don't have a doctor in Vermont, I could look up the University of Vermont Medical Center, and then there's a link that says find a provider or find a doctor, and you get a list of all of these doctors in the organization, and they have profiles on the doctors, what types of insurance they take, what their specialties are, what they like to do, what they prefer not to do as far as taking care of certain types of patients. Like some patients will be, or some doctors do OB/GYN care, and some doctors don't. But you have the option of deciding, and there's a phone number in general where you can call to try to make an appointment. And when you try to make an appointment with your doctor, they will, or with that doctor's office, there's generally a request for information that they'll need. And usually those are things like, where were you born? Your date of birth, your age, your phone number, emergency contacts in case something happens, um, your driver's license or some type of federal identification, your medical history from other facilities if that's available. But then the other thing they will want is insurance in most cases and situations. And that can be a big barrier for a lot of people too, because insurance is an important way of sort of paying for your medical care, especially since, not many of us can give away $5,000 when we're doing a lab test. I wish I could do that. That would be great. But so insurance can be very helpful for that. So to get insurance, fortunately, Google is useful in that, and you can type in "I'm looking for insurance" or health insurance, and many sites initially will point you to sort of finding health insurance that fits for you. And through the Affordable Care Act, which is one of those avenues, they can actually help you navigate that search for an insurance plan, a health insurance plan that would benefit you and or your family. And this can include Medicaid-based care, which is very beneficial for individuals who are low income or individuals who do not have an income per se. So, there's a couple of ways to navigate that process of finding insurance. Um, I do want to also say that there are medical facilities that will offer community-based care and support around that. So the Community Health Centers of Burlington is a great example in that many refugees or individuals who are just coming into the country and don't have a doctor or insurance, they can be seen at that office, and the group there will work together. Their social workers will meet with the patients and come up with a plan of finding insurance, of finding ways to pay for their medical support and care, and any additional services as well too. So there are medical facilities that will focus quite strongly around those specific things too. So there is definitely a need and a desire for more support around it, and it's just hard to find sometimes. But those are some ways.